choices, 212 choices to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hi, good morning. We have Herb on the line. Good morning, Herb.
Herb, are you there?
Well, I can't hear Herb, so we're going to keep on talking. Do you hear Herb?
Let's try again. Herb, can you hear us?
I can't hear Herb. I don't know.
Wait a minute.
I can hear you, Herb.
Yeah, but I can't, so what can I do?
So you speak to him.
Oh, hi, Herb. How are you? Hello? I don't hear Herb, so you can call back. I'm sorry. I know who you are because Herb's got a great story to tell, but call back when you want, Herb. We love you, and let's hear your story. Let's tell the people about your wife. So there's a news article, and it's not surprising. Doctors looked at how long colonoscopies take. So how long do you think colonoscopies take?
I'm gonna go with an hour.
Okay, well, it's kind of like sex. Everyone thinks it's longer than it really is.
Okay.
And probably like sex, probably the better is probably longer, right?
Right.
So here's a study that was published that looked at polyp detection, and the detection rates were highest when the colonoscopy time was the longest. Okay? So sometimes doctors put the colonoscope in. Colonoscope is the scope that is like the camera. It goes into the anus, into the rectum,
right,
into your colon after you clean it out with enemas and things.
Sure.
And the idea is to look for cancers.
Right.
And we know that we can decrease the risk of cancers in people that have colonoscopy.
Okay.
And usually it started at age 50. Most all Americans should have colonoscopy on a regular basis at that age and older. But what happens when the doctor pushes the time? Because everyone's in a hurry, right?
Yeah, sure,
Hurry.
Uh-huh.
And we talk about it all the time, give the patient the chance they need.
Yeah.
Right?
Yep.
Because the more time you spend with the patient, the more you learn. So here's a study, and it found that the detection rates were the highest of polyps and cancers when the colonoscopy times were the highest. So the recommended time for colonoscopy is 6 to 10 minutes. It's not very long.
Right.
Right, to go from one end of your colon to the other end,
yep,
with the doctor looking at the entire colon. Now, if you do 9 minutes, if the doctor takes 9 minutes, they have the highest detection rates for polyps and abnormalities. For each minute above 6 minutes, the incident rates of detection was significantly increased by 50% for each minute.
Each minute. Wow.
So you can imagine if a doctor just goes in there and pulls it out in a couple of minutes, what's he going to see?
Right.
He's not even giving himself or herself a chance to see anything,
yep,
right? And how do patients know about this? Well, maybe it's good to talk about it. Doc, how much time are you going to spend with me?
Yeah, sure.
Doc, if you're in a colonoscopy, and all of you in the listener audience, either you've had colonoscopies, you will have colonoscopies, this is important. How much time are you going to spend with me? Maybe you should have your loved one sitting outside the door with a stopwatch saying, I read this article, I heard from Dr. Lederman that if you take at least 9 minutes, you're going to get more than 50% better detection rates.
Sure. You got to look to see. Is that
You got to look, and it takes time to see.
That's right.
So it's really important. Now, what did the authors do? Well, the authors took 8,000 colonoscopies from about 8,000 patients that were perforated by 42 different doctors between 2009 and 2011. So it's recent. This is all in New Hampshire, so a date with good doctors and good colonoscopy. And then they analyzed the detection rates. It was in hospital practices, private practices, academic practices, community centers from a variety of specialties. And colonoscopy is one of the highest performed tests in New Hampshire. So it's about 76%.
Yeah.
In most states, it's only around 50%. So the normal withdrawal time was from 3 to 10 minutes with an average of 8. So for the people that did 6 minutes or less, that happened 24% of the time, the detection rates fall. And the detection rates were higher if you withdrew the scope over 9+ minutes. So again, it's a point, Doc, take your time. When I was a little boy in Iowa, I remember my grandfather would go to the doctor, and he would tell the doctor two things when he was seeing him. He said, Doc, do you mind? Close the door and sit down and stay a while.
Take your jacket off.
And this was 50 years ago.
Yeah.
50 years ago,
Right.
my grandfather, it's one of my earliest memories. Doc, close the door, sit down, and stay a while.
Yeah, and that's kind of your approach. I know we've had this conversation over the air many times. You sit with the patient, you listen, and that's
You have to
the most
do that.
important.
It's really critical. It's really critical.
Yeah,
You have to listen to the patient. If you don't listen to the patient, you're going to get into trouble, and we don't want to get into trouble. I have a story about a man with penis cancer.
Okay.
So this man came. One of the biggest factors that causes or is related to penis cancer is actually uncircumcised penis. So
Okay.
the foreskin is not removed. In America, most men have been circumcised. There's a group, obviously, that's not. In Europe, it's just the opposite.
Yeah.
Most men are not circumcised. With the circumcision, the smegma, it's called, the material under the foreskin, is cleaned if you are circumcised.
Yeah.
Without circumcision, it's harder to clean.
Right.
That's probably the cause of the increased rates of penis cancer in men who are not circumcised. So if you're not circumcised, you may want to think about getting circumcised. There are medical reasons. There's also less infections
Sure.
in yourself and in your sexual partner, your girlfriend or your wife. So if you're the girlfriend of a wife of a man who's not circumcised, you may want to think about encouraging that man.
Sure.
Anyway, this man came. He's about a 60-year-old man with penis cancer. He came to us a year ago. And a year ago, we put together a program using radiation called radiosurgery, so focused in on the cancer, and a little bit of chemotherapy to sensitize the cancer to the radiation to try to save his penis.
Mm-hmm.
Now, he went to a big cancer hospital that likes to do surgery.
Right.
So we went back and forth, and finally this man just gave up, and he had surgery. He went for surgery.
Right.
This week I saw him. It was the first time I saw him after the surgery.
Mm-hmm.
He had surgery in August.
Okay.
So his doctors told him before the surgery that they were only going to remove part of his penis.
Right.
He woke up and he had a catheter, and he said he couldn't see anything. He's a dwarfed. He's a midget.
Okay.
So he has another medical condition.
Sure.
And he said he couldn't bend over to see what they had done.
Yeah.
And they were going to send him home with a catheter, and he said he's not going home with the catheter, and he and his sister protested, and finally they removed the catheter, and he went home, and he looked in the mirror and saw that they removed his entire penis. And he was so angry that he was told they're only going to do partial removal.
Right.
And furthermore, they left massive cancer in the groin. He has lymph nodes the size of fists with an S,
Yeah.
in the groin. So they removed the little cancer in the penis, but they left all the massive cancer in the groin.
Right.
Now, he's totally lost faith in that
Approach.
cancer hospital
Yeah.
and his doctors there. They cut off his penis. They left the cancer. Where they cut on the penis, the margins, which means how much distance there is from the cancer to where they cut, are positive.
Right.
So it means they cut through the cancer. So now we're getting his scans together. Excuse me. We're trying to get the new and the old scans together to compare what he had to what he has today, where the problem lies. He hasn't yet been staged up. To get fully staged, you have to do a scan of the whole body to see where exactly the cancer is. Is it only in that groin area? He says he believes other areas in the pelvis, cancer. And by waiting, by getting treatment that is, let's say, not what he sought,
Yeah.
he says.
Yeah.
He may die if he doesn't make the right decision. I told him, he has choices, just like he had choices a year ago
Yeah,
when he
sure.
chose not to have treatment that would have saved the penis. Now he's lost the penis, and he has extensive cancer.
Right.
So we wish him well. It's very important for people to get second opinions and to contemplate second opinions.
Yeah, sure.
And surgery alone does not necessarily cure anybody. We have another article we're going to be talking about in a few minutes that actually shows that women who have metastatic cancer of the breast, who then have surgery on the breast, have a higher recurrence rate than those who don't have surgery on the breast. So it's not always necessary to do surgery. Just because the surgeon's pushing you for surgery, look for the data.
Yeah.
Ask for the data, because the data is the key issue. So in this man, we can't put him back together again. We wish you could, but we can offer treatment to try to control the cancer. So that's what we wish, to try to put together a program to control the cancer in a non-invasive way. We got a call last night from a woman sister actually. Woman's 55 with lung cancer. She was diagnosed 14 months ago. She's been getting chemo for stage 4 cancer. She has cancer in the lung, cancer in the brain. So 2 sites.
Gotcha. Mm-hmm.
2 sites. She had 14 months of chemo. She's having chemo. She wanted to know what her options were. Well, there's 1 mass in the chest, 1 mass in the brain. I have not seen the scans yet, but most probably for a patient like this, we could use fractionated stereotactic radiosurgery for the mass in the lung, for the mass in the brain, and it's very likely put her into remission with these 2 other masses that she has. Our treatment is non-invasive, so it may offer a lot of appeal for this woman. The chemo's not working. She's had a lot of complications from the chemo. So again, I sent her out a booklet, and we have booklets, by the way, which I didn't mention, but if you call our office at 212-CHOICES, 212-CHOICES, which is 212-246-4237, we'll send out a booklet about radiosurgery. We actually have 3 booklets, one about brain tumors treated and brain cancers, one about cancers of the body, and then one exclusively about prostate cancer. So just tell us which one you want.
Yeah. There's
no cost, no obligation. We'll stick it in the mail, and you'll have it within a day or 2 with some beautiful postal stamps on the outside.
It's definitely, I've looked through them all, and it's definitely worth reading up on. It's eye-opening. And,
it's eye-opening.
Yeah.
It's eye-opening that there's choices out there, and you don't have to get stuck with the first opinion.
Yeah.
First opinion's great, but it may be incumbent on you to get other opinions before you make a decision. Herb, you can call us back. We want to hear from you, Herb. So please, Herb, call us back. We want to hear about your story and how your wife fared over the last 15 years. This is a gentleman, I haven't heard his voice in a long time, but I recognize his voice.
I hope we can get him back on the line.
His wife had a terrible brain tumor. She came to us. We treated her with fractionated radiosurgery, and she's doing well 15 years later.
Great.
We're going to hear from our sponsor, and then we'll be back in a couple of minutes to talk more about news and patients.
Great.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. Good morning. We're back. I want to talk about an article that was in New England Journal of Medicine, which was one of the main medical journals in America, and one of the most prestigious ones. And it's about smoking. So I know many of us are around smokers. Many